Good day, class. I'm your instructor, Danny Anderson, and today we're going to be talking about anesthesia. We're coming out of the Foundations of Adult Health Nursing by White. This is chapter 1. Anesthesia is the absence of normal sensation. Analgesia is pain relief without anesthesia. Some local anesthetics can be used for pain relief. Usually they are given at low doses. Anesthesiologist is a licensed physician educated and skilled in delivering anesthesia. An anesthetist is a qualified RN, dentist, or physician that is also administering anesthesia. The jobs of the anesthesiologist and the anesthetist, they normally assess the patients or the clients, their health status. That helps them to gather a plan for the appropriate anesthetic they're going to use for this client. Because certain clients with certain health risks have to have special considerations. For example, if a client already has congestive heart failure, which says their heart may be weak, you want to know that when you're adjusting your dosage of anesthesia. They also explain the risks and the benefits of anesthesia too as well. The benefits of anesthesia is pretty much what we expect. It prevents any sensation of pain when it's administered properly, and the client usually has no memory of the surgery. So it also causes some amnesia of the event. So who would want to go through surgery and remember every cut, all the noise, all the pain? So that's one of the benefits of anesthesia. But it does come with some risks, though. Due to the loss of the ability to control certain physiological functions, anesthesia can cause death. And what I mean by this is anesthesia can lower your heart rate because your body doesn't have the ability to control it as well as when you're fully conscious. It also lowers your respirations, and oftentimes people have to be put on a ventilator during surgeries, which is a machine that helps to breathe for them. Clients also lose the ability to control their own body temperature. So a lot of times they're wrapped with blankets or some type of warming device. Another thing that normally happens during your pre-anesthetic care is the sign of informed consent. The consent is the permission to do the surgery. You have to make sure your client is able to make those types of decisions. So usually the doctor or the nurse, the advanced practice nurse that's going to be administering the anesthesia, explains the procedure to the patient. They explain to them the type of anesthesia they'll be using. Oftentimes, if they know the duration of the surgery, how long they'll be under anesthesia, they explain to them the preoperative care that the client will have to do. And they also explain to them the risks, which can include death. And then they usually leave it up to the nurse to come in. And the nurse's job is to make sure the client understood what the physician has told them about the anesthesia. Also, to make sure that they understand about the surgery as well. So you're kind of the fail-safe. Oftentimes you can catch when a client doesn't quite understand or they have some more questions for the doctor. You can notify them and let them know that, hey, this client is not ready to be consented yet. They still have some questions. But once they sign the consent, they're giving you the okay to be put to sleep or anesthetized. At any time before the surgery happens, just because the client signs a consent doesn't mean they have to have the surgery. You can always opt out. Another responsibility of the nurse is to obtain the preoperative checklist or to complete it. And the preoperative checklist goes over certain things like the client's allergies, Make sure they have a history and physical on the chart. You kind of go over leg exercises. Um, you make sure they have all the required labs that were ordered on the chart and things like that, removing their jury. It also asks if they have family members available, and it also puts where they're available at. Sometimes they're allowed to wait in the room where the physician can call and update them during the surgery. Sometimes they have a special waiting room, a surgery waiting room where they can be updated at. And this form kind of gives the surgery team an idea about the patient and what's available for the patient. So the nurses normally do the preoperative checklist as well. Another responsibility of the nurse is also to make sure that all the preoperative orders are done or executed. In other words, a lot of times there are orders that has to be done before the patient goes to surgery. For example, NPO, which means nothing by mouth. A lot of times surgeons require, or anesthesiologists require, that patients have nothing to eat past midnight. Some of them have their own special rules. They allow them to have ice chips or medications and things like that. But whatever their order is, as far as their eating status, make sure that has been followed. Some physicians like to order, or anesthesiologists like to order certain medications held or certain medications to be available. Sometimes they want to give a mild sedative before they take them down to surgery. Whatever the preoperative orders are, we want to make sure that we're following those as well. Another responsibility that kind of falls on the nurse is checking, verifying, and documenting all the client's allergies, which is also part of that preoperative checklist. But you also want to make sure that the patient does have an armband on that states those said allergies. If the physician has ordered you to administer medications prior to surgery, a lot of times those medications are given with a small sip of water. And certain medications are typically always held. So if you see medications on the chart that you know are typically always held, you might want to raise a red flag and ask a physician, hey, are you sure you want to give this to the patient? Example of those medicines are, they usually hold NSAIDs, especially aspirin. NSAIDs is non-steroidal anti-inflammatory drugs, especially aspirin. They normally hold those 10 days to 2 weeks before surgery. Another medication that they normally hold are any anticoagulants, which means it keeps a person from clotting. So they are at a high risk for bleeding when they have anticoagulant on board. Medicines like Coumadin and heparin. Coumadin is normally held about 10 days prior to the surgery. Heparin is stopped within hours of the surgery. Depends on the physician's depends on how he wants to hold it. Some hold it 6 hours before surgery, some 12 hours, some 4. So, but if you see it on the medication record for the patient, that might be a red flag to ask the physician, are you sure you want to give these medications? Another medication that's commonly held are insulins or your diabetic medications. These medications are commonly held and they're also commonly given. What category they fit in, whether they're given or held, depends on the physician's judgment. Some people are diabetics that are hard to control, and in those patients, sometimes they will continue their daily diabetic medications. Some patients' diabetes are under control better than others, so they may hold these patients' diabetic medications. The reason why they may give it or hold it is because they don't want a patient's blood sugars to elevate to dangerous levels during a surgery, during a high time of stress. You also don't want a patient's blood sugar to drop to dangerous levels during a high time of stress during the surgery procedure as well. Another medication that is commonly given, though, is cardiovascular drugs, particularly antihypertensives and antiarrhythmics, because these medications keep patients' blood pressures regulated, and it also keeps their heart rate regulated. And because anesthesia can already be taxing on the cardiovascular system, you want to try to keep the patient medication regime as normal as possible to keep their heart rate regulated at their normal baseline. A lot of these patients also have eating restrictions, except for the medications with small sips of water, because during your being under anesthesia, you don't have control of your gag and cough reflexes, and a lot of muscles in your throat area, your esophagus, vocal cords relax, so your lungs are not as protected as usual. So if you have content that come out of your stomach, and it can easily enter into your lungs and cause aspiration, which is a foreign fluid or objects in your lung. Basically, you drown in your own bodily fluids is what that says there. And you want to make sure you give your administer preoperative medications at the time they're ordered. This is especially true with antibiotics because due to certain regulations, antibiotics for prophylactic reasons are given within a certain time period before and after surgery for a lot of hospitals or surgeons to meet their standards, their surgical care standards. If any of the preoperative medications cause complications or or arises some cause of concern, you always want to notify the physician, the anesthesiologist, and the surgeon. For an example, if you give their scheduled blood pressure medicine that they okay to give through the orders, and all of a sudden the client becomes extremely hypotensive, they want to be notified of that. For example, if they decided not to hold their diabetic medications and said it's okay to give the client their morning blood sugar, insulins, or their morning medications like metformin or glucophage, and the next time you check their blood sugar, it is low, they're hypoglycemic, you also want to notify the surgeons and anesthesiologists of that findings too as well. You also want to be sure the client's chart is complete. You have to keep in mind that we're handing this client off to a whole team of people who may not be as familiar with this client as we are. And the client will be anesthetized, which means they will be asleep. So at that point, they're no longer a source of information. They may even have you give them some sedating medication to relax them, to keep them from being so anxious. So even if they may be a source of information, they may not be an accurate source of information. So they rely heavily on the charted information that you have available to them. So you want to make sure that the chart is complete and all the information that they need is at hand. And you want to make sure the client's consent form is signed, that they approve the procedure that's about to happen to them. All right. Okay, now we're going to talk about sedation. Sedation is given in the form of medications a lot of times, and the reason for it is to reduce stress, excitement, or irritability. Sedation medications have an effect on your central nervous system. It actually depresses it, and when I say depresses it, it lowers your respiration and also lowers your level of consciousness at times. Medications commonly used are benzodiazepines, such as Versed, Valium, and sometimes Ativan. They also use opioids, but opioids have a less sedating effect than benzodiazepines. Opioids like morphine, Dilaudid, fentanyl, they can be used to help calm a patient, especially if their anxiety is caused by their pain. So getting rid of their pain or lowering their pain also in some cases lower their anxiety. But remember, it does not have as much a sedation effect as benzodiazepines. They're also used to decrease awareness of events. Like we were saying, a little bit of amnesia there, so you won't quite remember the procedure or on your way down to the operating room. It helps relieve anxiety. It also controls the physiological changes that often accompany anxiety, like the increased diaphoresis, the rapid breathing, the rapid heart rate, the increased blood pressure. It helps to keep your body at a normal acting range. And also eases the induction of general anesthesia. Because they work hand in hand, looks like I'm running out of time. We will continue on the next slide. Thank you.